Well, look, I mean, I think bottom line where we are, we've been in the Trump administration for 8 months. He has systematically made America poorer and sicker, period. And the healthcare decisions he made in July in the big, beautiful bill. Yes, they cut Medicaid. Yes, they cut subsidies to Obamacare. But in response to that, every single American, including I'm sure you and I, on private employer provided health insurance, is either getting or is about to get a letter that says your health insurance, your private employer insurance is going to go up by 10 to 20% as of January 1. On the House floor or Senate floor yesterday, I held up one of those letters. I mean, these are very real. And everyone should understand that whether you're on Medicaid or you have an Obamacare marketplace plan, that's one thing. That's a real problem, right? At risk of losing your insurance. But everybody else who thinks that's not about me is going to be the bill payer for the loss of that health care for others.
This clearly isn't March of earlier this year. Democrats seem more afraid of backing down on this issue than of a shutdown itself. Where do you stand on that?
Look, I don't think there's a single person who wants a shutdown. I was a federal government employee for 16 years. Shutdowns are not good.
Nope.
But I think there comes a point where, like, you have to have a little self-respect and say, if you want my vote, right? Because they need 7 Democratic votes. If you want my vote, you have to come and talk to me like an adult, right? Like every other person I know, every Michigander I know at work doesn't get everything they want. They have to sit in a room and hammer out compromises. And I know that I'm not going to get everything, right? I want to restore a ton of the healthcare. I want to lower the price of healthcare for all of our constituents. But Republicans have the White House, the House, and the Senate. So I'm a realist. I'm not going to get everything back. But you cannot count on my vote if you're not going to have a real conversation about healthcare in America, and especially the way you've already started to devastate it. I'm willing to have that conversation, and I'm a more pragmatic member on the Democratic side. So come and talk to me. But you should know that I'm going to start by saying, what can we do to lower the price of healthcare for people? Like, you got to be hearing that same thing from your own constituents.